Hi everyone, so this video is going to be for the Step 2 CS, and it's going to be a video, as you can see from the name of the video, about the blue sheet. What is the blue sheet? The blue sheet is the pieces of paper that they give you to write whatever you want on the day of the exam. You get 12 pieces of paper, and these pieces of paper are written on. At the bottom it says like 1 of 12, then the second page will say 2 of 12, etc. until you get to 12 of 12. And there's some writing on the top, so that takes away a little bit of your space. Now this piece of paper is, you have to turn it in to the proctors at the exam at the end of each case. And you cannot write on these pieces of paper until you get the alert or the announcement that the case has started. So I've heard of a few people that have gotten in trouble for writing. So you do not start writing until you get that announcement. What I write on the blue sheet. I make 4 boxes. Like this. Okay? And I'm going to go through each of these mnemonics, but I'm just going to quickly tell you what I put in each box. Okay? In this box, I put SIQORAAA or SIQORAAA. I will explain this in a second, but this is your history of present illness. In this box, I would put then FR CS PUBSAWED. Okay? Like that. Then FR CS PUBSAWED. Okay? And then in this box, I put PAM H FOSS. Okay, PAM H FOSS is your past medical history, and the then for CS is your review of systems. This one here. Okay? So, and then in this box, this was like whatever I wanted to write here, and my differential diagnosis. Okay? So let's put diff diagnosis. So I'll put my differentials here, any extra stuff I wanted to write, if I had to screen, etc. I left this box open for that. So that's what I would write. Now, if you have a pediatric case, then you're not going to use them for CS PUBSAWED. I would use fever cud or fever cuds with an S. And then I would use for past medical history, PAM if big deals. I will go through all of these and I will put them in the description box as well. Now, SIQORAAA, basically, I'm going to read them out to you. I have like little note cards where I also wrote them. So SIQORAAA is what you're going to use for your history of present illness, or LIQORAAA. L or S. L is location, S is site or symptom. You can, it's the same thing. Then I would be intensity, which is for pain, 1 to 10. Q is quality or quantity. O is onset. Under onset, I would also write duration, course, the frequency of the pain, etc. Radiation is R. A, aggravating factors or alleviating factors or associated factors. So that's 3 A's at the bottom. I hope you guys can see this. And if it wasn't pain, if it was anything else, then I use DOCPAAA, which you can see here. And DOCPAAA is D, duration, O, onset, C, continuity, P, progression, and then the 3 A's, aggravating, alleviating, or associated problems. So that's your history of present illness, and that goes on the upper left. History of present illness. Okay? Anything else I had to write, I would put there. Now, what do you do in these boxes? Here you're going to write a little bit more because it's more specific. When you get here to the then for CS PUBSAWED, this is basically a checklist, okay? If it's there, you check. If it's not, you put an X. That's what I did. I didn't write anything. I would just check or cross out. And this is your review of systems. So your review of systems, let me read them because I forgot them already. Then for CS PUBSAWED. The T is if you have any problems in temperature, any trauma, or any travel. The H, headache. The E, edema. The N, nausea or vomiting. The F, fever. The R, racing of heart or rash. The C, chest pain, cough, or care, if the patient can care for themselves, etc. S, shortness of breath. The P in PUBSAWED, pain in joints. The U, urinary problems. The B, bowel problems. The S, sleep. A, appetite. The W is weight, if they've had any changes of weight, how much weight have they lost, over how much time, was it intentional, etc. The E, if they exercise regularly. And the D, dizziness. And if they do say they have dizziness, then you should ask if they have vision problems as well. Okay? So it's just check or cross off, and you ask only the things that are important. I said that in my last video. It's going to help you save time. Urinary and bowel, you ask in everybody. Sleep problems, I would ask in everybody. But some stuff, you don't need to ask. You know, if it's not associated to the case, don't ask. Remember, they have a checklist. So just ask a few things that are pertinent, and that's it. So that's your review of systems for adults. The review of systems for children. The mnemonic is, I'm going to try to write this as I'm going so that you guys can see. Hopefully I'll be able to do that and edit it and get it up in time. Okay, so the mnemonic for review of system for kids is fever, cud, fever, cuds. So here it goes. F, fever. E, ear pulling. V, vomiting. E, ear discharge or eye discharge. R, rash. The C in cuds. C, chest symptoms. Cold, such as runny nose, cough, chest pain, shortness of breath, drooling, difficulty swallowing, etc. The U, urination, increased or decreased, number of wet diapers, odor, color, dysuria, all of that you would put there. Diarrhea, then you're going to ask frequency. Onset, is there mucus? Is there blood? Do they cry when they defecate? Another D is dehydration. Do they have dry mouth, sunken eyes, wet diapers? And then the S is seizures. Jerky movements. Do they have any leakage of urine or stool during the seizure, after the seizure? What's the postictal state? What's the level of consciousness, etc. So that's going to be your review system for pediatric cases. Now we move on to this box, which is going to be your past medical history. For adults, we use PAM H FOSS. PAM H FOSS stands for P, there's been any previous episodes of the chief complaint. A, allergies. M, medications they're taking. H is history. For history, I use the mnemonic under history. Under the H, I use another mnemonic that's hits. Hospitalizations, major illnesses, trauma or surgery. So under the H for PAM H FOSS, the H, I also have a mini mnemonic within it, which is hits. Okay? Now, some people use the hugs. You know, I don't use the hugs because I already asked urinary and gastro and sleep in the review of system in my other mnemonic. I don't use PAM Hugs FOSS, I just use PAM H FOSS. Now, getting to the FOSS. F, family history. O, OB-GYN history. So you're going to ask last menstrual period, when was their last PAP, if they're above 50, if they've had a mammogram, their last PAP exam, was it normal, have they ever had an abnormal one? You ask the result and everything. Then the S is sexual history. You're going to ask number of partners, what type of partners they have. Don't assume that because it's a woman that she's heterosexual, or if it's a man that he's heterosexual. Ask what if their partner is a female, a male, both, etc. Number of partners they have. Do they use protection with their partners? You're going to ask all that under sexual history. Then social history, I have another mini mnemonic under social, which is warded. Work, home, alcohol, recreational drugs, tobacco, exercise, and diet. See, I have exercise here, so I never used to ask it in my review of systems. Now, if they tell you that they smoke, remember to ask your packs and numbers of years so you can get pack years. And if they tell you they drink alcohol, remember to ask CAGE, the CAGE questionnaire, okay? You all should know what that is by now. I'm not going to talk about it. So anyway, for work, home, you're going to ask if they live in an old home, and etc. And for work, what they do for a living. You can skip these things if it's a case that's very characteristic and you know it has nothing related to work or home. I usually ask most cases. I just got used to asking it. So that's going to be your past medical history for adults. Now, for children. So that's this here. For children, you're going to use PAM H big deals. Okay? And here we go. The P, past medical, surgical, and previous hospitalizations. You're also going to ask the prenatal history on here. So all of that is P, past medical, surgical, past hospitalizations, and prenatal. A, allergies. M, medications. Now if. I is ill contacts. F is family history. B is your birth history. I, immunizations. G, growth and development. You're going to ask prenatal, birth, neonatal, feeding development, their routine care, their immunization, checkups, all that goes there. Then deals, the word deals. The D is daycare, if they attend the daycare. E, their eating habits. A, appetite. L, when was their last checkup? That's also what the baby looks like to you, their appearance. And the S is sleep, if the baby sleeps or not. Okay, so that's going to be your past medical for babies. So that's basically it. History of present illness goes here. Review of systems goes here. Past medical history here. And here you're going to write your differential diagnoses before you walk in. And you're also going to write anything that the patient tells you that you want to write for your typing. Like I said, remember when you're using your blue sheet, don't look down at it the whole time. You should make eye contact with the patient. That's very important. So you're going to say, for example, Mrs. Smith, have you had any problems with your temperature? Mrs. Smith says, no. You look down, you make an X at the T here under review of systems. You look at the next one, and the next one is H. You look up, Mrs. Smith, have you had any headaches? No. Okay. You go down and you look at your next letter. You should not be looking down at your sheet the whole time. Do you have any edema? Do you have any nausea? Do you have any? No. You have to look up, ask the question, Mrs. Smith, have you had any nausea or vomiting? No. Okay, you look down and you go to the next one. The next one is F. Have you had any fever or chills? Like that, you know what I mean? So that's what I would do, and I would just cross off or check off. This looks very nice and neat. I actually have one here that I use for practice, and it looks a lot messier. See, so you see there's some writing. I hope you guys can see this. And most is just checking off X's, you know, whatever. That's basically it. I hope you guys enjoy this video, and if you have any other videos that you'd like to request for the Step 2 CS, please leave it. I'll try to make those videos next week. I hope you guys are having an awesome week, and I will see you guys soon. Bye.